Now remember, we're talking about $20 billion required in extra funding to fund all of the recommendations in the Aged Care Royal Commission. So that's almost, not quite, but almost twice as much. These large tax cuts are almost twice as much as what is required for this extra funding for aged care. And when we had this debate about, cutting tax cuts, the government was never talking about how they were going to afford it. It was just going to be absorbed.
One for Mum, one for Dad, and one for the country.
And there has never been a more exciting time to be an Australian.
Budgets are about choices, Fran, and you show what you value through the choices you make.
Dead, buried, cremated.
This is coal. Don't be afraid. Don't be scared.
The Treasurer.
Australia's basically done for. We'll just end up being a third-rate economy. A banana republic.
How good is Australia?
Just follow the money.
G'day and welcome to Follow the Money, the Australia Institute's podcast demystifying the big economic issues in Australia and putting them in plain English. I'm Ebony Bennett, Deputy Director at the Institute, and today we're going to talk about the Aged Care Royal Commission and how decades of tax cuts and concern about budget savings directly contributed to the aged care crisis we now face.
Well, after nearly 2.5 years of hearings and evidence from more than 600 witnesses
and over 10,000 submissions, the shameful findings at the Royal Commission into aged care, the other...
Dinner time was like a couple of party pies and a scoop of mashed potato.
Brian, a double amputee, had been left out on the rooftop terrace for 2 hours. And tragically, Brian died on the 20th.
I think the main finding of the report that's so shocking is the way it castigates the lack of leadership, governmental leadership on the issue of aged care.
Can the market deliver an effective care system? And I would have to say that after 20 years of the market, my assessment is that the market has demonstrably failed.
The Royal Commission made 148 different recommendations, and that's after almost 2 years of hearing evidence from more than 640 experts, residents and families over about 100 hearing days, and also listening or reading more than 10,000 submissions. The Royal Commission found the level of abuse and neglect was unacceptably high in the aged care sector, with an estimated 50 alleged incidents of unlawful sexual contact per week. It found that patients are commonly malnourished and dehydrated, and that a significant funding boost is required to fix things, including more and better trained staff. Basically, they summarise the problem as abuse and neglect.
A Medicare-style levy where all workers make a contribution is one option under consideration as the federal government works on fixing Australia's aged care system.
It ends up at something like $130 billion a year by 2050 needed to provide an adequate aged care system.
Among the recommendations in the Aged Care Royal Commission report is the call for an effective 1% increase in the Medicare levy or a new Medicare-style aged care levy, which could be applied progressively based on income. And though they differed slightly on the funding mechanism, both commissioners agreed that an increase in tax is required to generate the revenue that we need to provide the aged care sector with stable, predictable and equitable funding that it requires in the long term.
What's in the best interest of our older people? And then what are the best answers?
Yeah, if both sides came to the party, you're right, Bill, if both sides came to the party on a new levy, it's a new tax, yes, but you're both agreeing, and it doesn't come across as a new tax. It comes across as a rescue package for elderly people.
So today we're not going to dive too deeply into the issues around how to improve the aged care system. There are a lot of specialist health policy and service delivery organisations out there who are talking about that in a lot of detail. We are going to follow the money. We're going to talk about the importance of securing revenue in the long term to fund government services like aged care. So I'm delighted to introduce the Australia Institute's senior economist, Matt Grudnoff. G'day, Matt.
G'day, Eb.
So, Matt, just kick us off with the overall picture. I know it only came out yesterday, but what did the Royal Commissioners have to say about the state of aged care funding in Australia?
Well, they had to say that not enough was being spent. They said that the government currently spends about $20 billion a year and that they probably need to spend about twice that. And recognising that an extra $20 billion a year was a lot of money, they've also suggested a number of ways that we might raise it. And they had several different types of ways. They had a broad-based Medicare levy, which would apply to everybody with incomes over about sort of $28,000 a year. They had increase our progressive tax rates, so each of the tax rates at the various levels would go up by 1% or so. And they also had suggestions around that younger people would finding it harder, that they had to pay off their education, that they were saving for a house, and so that perhaps we should have a levy that only applies to people 40 years and over. So they had quite a number of ideas on how to raise revenue, and this is great that we're actually starting to have a talk about how we're going to fund this rather than talking about we should always just cut taxes.
Yeah. So I'll come back to those detailed kind of proposals that they had in it, but I just want to kind of stick with the big picture. So you've just said that overall funding needs to more or less double at the very least in order to get it where it needs to be. And that basically where we're at now is having a discussion about how we can raise the revenue, not whether or not we need to raise it in the first place. Is that a good summary?
That's exactly right.
So one thing that I picked out, and I certainly haven't read all 8 volumes, but I've been going through the recommendations and the executive summary. And one thing that really stuck out to me was that the Commission found the introduction of the Aged Care Act in 1997, which way back then was the Howard government, that it removed the obligation of aged care providers to spend a dedicated portion of their government funding on direct care staffing. So basically they were saying it allowed providers to replace nurses with cheaper and less qualified staff and basically fewer of them, and that was really motivated by the government's desire to have savings in the budget, essentially, and that had led to compromised care for Australians in aged care. That really seems ass backwards to me.
Yeah, look, absolutely. Basically what they did was they deregulated it. And the reason they deregulated it is because they wanted to get people who wanted to earn a profit, for-profit providers, into the industry. And basically, if you want to see deregulation in care, you just have to follow the Royal Commissions. We've had the Banking Royal Commission, the Disability Royal Commission, and now the Aged Care Royal Commission. And they basically follow industries that should be providing levels of care and also are pursuing a profit. And when those two clash, it never ends well for the vulnerable. We saw in banking, vulnerable borrowers and lenders suffer. We've seen it in disability, and now we see it in aged care.
And that's really, that system over decades, we've really been seen more or less both sides of politics really pursuing budget surpluses as the ultimate goal. And we know that inevitably income tax cuts, which is something that the Coalition always drives for and brings to nearly every election, just decades of cutting taxes inevitably ends up with cuts to services, doesn't it?
That's right. So what the Liberal government like to do is they like to cut taxes, which creates a budget deficit, and then they roll in and say, look at this big deficit, that's unsustainable. You know what we should do? We need to cut services. And so that's basically their tactic.
Okay, so to dive back into the detail of what's in the Royal Commission's recommendations, though they've slightly differed on their mechanism, both of the Royal Commissioners have really recognised that more revenue is required to adequately fund aged care, and they've proposed, from what I can see, 2 slightly different models. So either basically a 1% increase in the Medicare levy, which would be paid by everyone, or a new Medicare-style aged care levy, but that would be applied progressively based on income. So what are the pros and cons of those 2 approaches?
Yeah, look, both of them would raise billions and billions of dollars. The 1% increase would raise about $8 billion roughly. And remember, we need to raise about $20 billion if we want to fully fund this. The progressive rates have been calculated so that they fully cover it. And basically what it means is that you would see each of our 4 bands, tax bands, increase by a few percent. So at the lower levels, it would only increase by about 1%. At the very highest level, it would increase by about 3%.
And so just to remind our listeners, the difference between like a flat tax and a progressive tax like that you were talking about there.
Yeah, exactly right. So a progressive tax means that the more you earn, as a percentage of your income, the larger amount of tax you pay. So people who can most afford it, people on, say, more than $180,000 a year, pay a bigger proportion in tax. So they pay at the moment about 47% tax. Whereas people on low incomes, say about $30,000 a year, only pay a smaller proportion of tax, about 20%, just under 20%. And so progressive tax means the more you earn, we recognise that you have better capacity to pay, so we make you pay a larger percentage. A flat tax basically means that the proportion, the percentage you pay is exactly the same regardless of your income. Now, that doesn't mean that people on low incomes pay the same amount of tax, because if you earn $35,000 a year, an extra 1% is not as much as if you 1% of 180,000. So that people on higher incomes still pay more, but it's a flat tax. And so as a general rule, it's not as progressive, and so therefore there's a larger burden on people on lower incomes.
So coming back to that idea of revenue, we have already talked about kind of decades of pushing for income tax cuts and cuts to public spending, and really the prioritisation of budget surpluses and reducing the debt and that kind of thing as the focus of budget policy. Matt, over the years for the Australia Institute, you've done a lot of work around the cost of the government's income tax cuts, as well as some of the more generous tax concessions that we offer each and every year. What does the picture for the Australian budget look like in terms of revenue at the moment with tax concessions and income tax cuts and company tax cuts and things like that? Is this a good time to have a bigger discussion about revenue?
I think absolutely it's a great time to have a bigger discussion about revenue. In particular, because we're talking about aged care, it's probably a really good time to have a look at how we tax older people, and in particular how we tax very wealthy older people. The tax system is insanely generous to older people, particularly those with a lot of wealth. So we have things like excess franking credits, which were a big issue at the last election. They go predominantly to older people and wealthy people. So almost 85% of excess franking credits go to people aged 60 and over. So we're talking about retired people. And almost 70% of all excess franking credits go to the richest 10% of all Australians. So older and richer is where excess franking credits go. Now, there are $5 billion a year, over $5 billion a year in excess franking credits. If we wanted to get rid of those, we could use that to help fund aged care. Another one that goes predominantly to older and richer people is the capital gains tax discount. Now, the capital gains tax discount means if you earn income because you bought something and then sold it at a higher price, so you made a capital gain, we only tax you at half the rate we would tax any other income. So if you go out and work, you pay twice the tax as if you just sat on an asset, it went up in value and you sold it.
So if you're a brickie and you build houses for a living, you're getting taxed
twice as much as somebody who buys a house and then sells it later at a higher price, or buys shares and sells it later at a higher price.
Okay, and again, that is a tax concession that mostly goes to older and wealthier.
Yeah, almost $10 billion a year, and 85% of it goes to people over age 50, so people approaching retirement or retired. And again, 75% of it goes to the top 10% of wealthiest 10% of Australians.
So it's really concentrated in who benefits.
That's exactly right. Now, those two combined make up about $15 billion a year, which is 3/4 to the $20 billion that's required for additional aged care funding. So if we were taxing just the very rich and older people, we could raise almost all of the extra money required just by getting rid of the capital gains tax discount and excess franking credits.
The other thing that it makes me think of is the absolutely massive income tax cuts package that the government put through in the last couple of years. Now, I think it's, we've been having a big debate about can we really afford to increase JobSeeker, for example. Everyone recognises that it's not enough, it's well below the poverty line. Had a huge debate, and then the government's kind of come back with this paltry $50 a fortnight. And part of the argument of that is a rubbish one about disincentivising people to find work. But part of it is, well, what can we afford? But how big is the income tax cuts package that's just passed, and how does that compare to the funding that's required for aged care?
Yeah, so the income tax cuts that passed will cost over 10 years $300 billion. And that actually makes it look smaller than it actually is, because the larger part of the cuts actually happen later on. So they get larger and larger. So when they're fully implemented, when all of the tax cuts are fully come in 24-25, in a couple of years' time, they will cost the budget in that year $36.2 billion just in that 1 year. Now remember, we're talking about $20 billion required in extra funding to fund all of the recommendations in the Aged Care Royal Commission. So that's almost, not quite, but almost twice as much. These large tax cuts are almost twice as much as what is required for this extra funding for aged care. And when we had this debate about, cutting tax cuts, the government was never talking about how they were going to afford it. It was just going to be absorbed.
Yep.
And so this is this weird dichotomy that we have, particularly from this government, around how we talk about tax cuts and how we talk about funding increases. If we want to increase and have better services, well, where's the money coming from? You need to lay down, exactly where it's going to come from. No, you can't increase taxes, which means any services increase actually has to come from service increase or cuts elsewhere in the budget. But when we talk about tax cuts, we can have enormous tax cuts, $36 billion in a single year going on forever. And we don't talk about where we're going to be funded. They just get absorbed into the budget.
We don't talk about if it adds to debt and deficit. We don't talk about any of that stuff that accompanies any kind of public spending.
Exactly right. And so there are entirely different ways this government treats them for essentially the same thing, that it will have an impact on the budget. And so we're now talking about how we can raise the extra revenue. If the government really wanted to raise the extra revenue, it could look at the worst parts of stage 3 of these tax cuts. It could stop them from going ahead, not increase taxes.
We don't have them yet.
We don't have them yet. They haven't come into force.
So no one's losing anything.
No one's losing anything. We could just stop them from coming in, and then we would have no worries at all funding quality aged care for people. So people could retire in dignity. They could get the care that they deserve in later life, and nobody has to pay more.
They could get 3 meals a day that cost more than $6.
Party pies and mashed potato.
Oh, God. It's really depressing kind of where we find ourselves, and that we've kind of let the economic debate go so far down this track of neoliberalism that we've ended up here, I guess. But
absolutely. But this is where profit motive and care collide. You talked about earlier, they changed the regulations so that they were able to make aged care cheaper. Unfortunately, the Howard government obviously just assumed that making it cheaper wouldn't lessen the quality of it. Clearly, that's not the case.
Yeah.
And when care and profit motive collide, we need to be very careful that what happens is we don't just see substandard, awful care for the vulnerable in order so that a company can make a bigger profit.
Yeah. As a final question, Matt, we're coming out of a recession that we were probably headed for anyway, but certainly the pandemic seemed to accelerate it. But we were before that in pretty bad economic terms in Australia. We had really stagnant and low wage growth. The economy was in the doldrums, and then the pandemic happened. Huge parts of the economy shut down, and now we've got much bigger unemployment and underemployment that we need to fix pretty soon. So aged care is obviously employment intensive. If we did throw all this money that's required at aged care, what would the impact be on the economy, and would it be good for getting us out of this recession and getting us back to low rates of unemployment?
Absolutely. Look, aged care is very employment intensive. In fact, it's one of the, for every $1 million you spend on aged care, you get almost the most number of jobs out of it. Other employment-intensive industries that it sort of stacks up with are things like education and health. Those three, aged care, education and health, most employment-intensive industries. If we were to throw billions of dollars at aged care, what we would see is a massive boom in employment. And if those reforms to aged care also encouraged more qualified people into it, what we would also see is a growth in wages. We would see a growth in well-paid jobs, and we would see unemployment fall, and the economy would get a big boost from that. Certainly far more than, for example, funneling money into get the gas industry and a gas-fired recovery. We get almost no jobs out of that. In fact, a report out today showed that they're actually cutting jobs in the gas industry. But certainly, if you look at the Commission's report, they're very critical at the level of staffing and the quality of that staffing. And this is a great opportunity for Australia to have a jobs bonanza, a great opportunity for them not only to increase employment, but to increase well-paid, good qualified employment.
So a boost for the economy, a boost for the aged care sector, a boost for wages, like really there's no box that doesn't tick in economic terms.
In economic terms, absolutely not. In political terms, it means having the government spend more. And so, I personally don't think that that's a problem, but, the government often runs this argument. But this ticks all the economic boxes. But most importantly, it ticks the dignity box. It ticks helping vulnerable people and ensuring that they aren't subject to the horrific stories that we've heard out of this Royal Commission.
Thanks, Matt.
Thanks.
This episode was recorded on Tuesday, the 2nd of March 2021, and things may have changed since recording. You can visit australiainstitute.org.au for all our latest research and analysis, and you can find us on Twitter at the Oz Institute with an AUS. My Twitter handle is ebony_Bennett with a _N_T, and Matt Grudnoff is at Matt Grudnoff, that's GRUDNOFF. This episode was produced by Jennifer Macy, and our theme music is by Jonathan McFeet from Pulse and Thrum, and additional music by Blue Dot Sessions. Stay safe out there, stay 1.5 metres away, keep washing those hands, and thanks for listening.